Welcome and thank you for joining us. Over the next hour, Susan Martino will present Lead Poisoning Prevention in Indian Country. This session is a virtual training to educate the environmental public health workforce on lead exposure hazards, population health risk, and disparities in Indian Country. I'm Christy Denbrock, Chief Learning Officer at NEHA, and I will be your moderator for today. Susan has over 35 years of experience in general environmental health. She was an environmental health specialist with Boulder County Public Health here in Colorado. Most recently, she was project manager for two large Colorado Department of Public Health and Environment cancer, cardiovascular, and pulmonary disease grants. A substantial portion of the grant work focused on underserved rural Colorado counties with vulnerable low-income populations. Susan received a Bachelor of Science in Microbiology from Colorado State University and worked as a chemist and a biomedical researcher. She also holds a master's degree in landscape architecture from the University of Colorado, Denver, with an emphasis in urban planning, health, and the built environments. Welcome, Susan. Would you like to begin your training?
Yes, thank you, Christy. I appreciate your introduction. And thank you, everyone who's attending today, and we'll get started. So we can go on to the next slide, and I'll begin. And all right. So the purpose of this training today is to educate the environmental public health workforce on lead exposure hazards and population health risks and disparities in Indian Country. It's also to expand awareness of cultural considerations specific to American Indians and Alaska Natives. And it's also to provide guidance and resources to support engagement and environmental health equity. As part of the training overview, I'll be covering tribal communities in the United States, rights of tribal communities, lands and cultures, environmental justice, health equity, lead poisoning risks, surveillance practices, and prevention planning. I'll also be discussing key barriers to strategic planning in addressing lead poisoning in Indian Country, and strategic planning considerations and support resources. Next. The Federal Bureau of Indian Affairs works with 574 federally recognized tribes across the country. 229 of the 574 federally recognized tribes are located within Alaska. Others are within 35 other states. 54% of American Indian and Alaska Natives live in rural areas and small towns. An important thing to point out here is that tribal nations have the right to sovereignty or to govern themselves. They also have government-to-government agreements or treaties with the United States. Tribes determine land and housing management practices, priorities for community services, and resource development, and how and if they will engage with partners. You can find out more information about tribal nations in your area by going to the website Native Land Digital at nativeland.ca. I'm going to talk about environmental justice principles because those are very important when dealing with tribal nations. The environmental justice movement emerged in the late 1980s when a report exposed massive disparities in the burden of environmental degradation and pollution facing minority and low-income communities. Environmental justice affirms the need for urban and rural ecological policies to clean up and rebuild our cities and rural areas. This should be done in balance with nature by honoring the cultural integrity of all of our communities and by providing fair access for all to the full range of resources. Lead hazard reduction programming should be developed through the application of the 17 principles of environmental justice. Engagement in lead poisoning prevention through environmental, health, and housing services is guided by environmental justice principles, which should be applied by federal agencies and others invited to work with tribes, indigenous peoples, and others living in Indian country. Next. I'm going to talk about some terms that will come up in this training that will be social determinants of health, health disparity, and health equity. Social determinants of health are the conditions we are born into, where we work, live, and grow old that influence our quality of life. Things like where you live, the air you breathe, social support, and your education level can also impact your overall health. Lead exposure in communities of color, such as tribal communities, is linked to the social determinants of health of neighborhoods and built environments, health and health care, social and community context, education, and economic stability. National lead poisoning surveillance data shows that most homes with lead-based paint hazards are in impoverished and marginalized communities of color, which may also have more limited resources available to create and implement strategic plans for childhood lead poisoning prevention. Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health experienced by socially disadvantaged populations. Lead exposure is a preventable health disparity. Health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. Public health and related services can support community efforts to build health equity by addressing social determinants of health and removing barriers to health equity through multiple services. Okay. All right, in our first section here, I'm going to talk about lead poisoning risks, which will include health effects, surveillance practices, which include CDC childhood lead poisoning prevention, lead screening, lead poisoning surveillance, and other federal lead poisoning prevention partners. I'll also discuss prevention planning, which will focus on knowing lead exposure sources in your communities. Some of these sources that I'll talk about are housing, water, land and soil, air, occupations, hunting and fishing, and consumer goods and products. Next. Lead is a neurotoxin that can cause lifelong learning and behavior disorders. There is no known safe level of exposure to lead. The lead dust equivalent of 3 granules of sugar can poison a child. And despite being poisoned by lead, some children may show no symptoms. Children from birth to age 6 and pregnant people are more likely to absorb lead in their environment. Pregnant people exposed to lead can experience reduced fetal growth. The Centers for Disease Control and Prevention, or CDC, administers the federal childhood lead poisoning prevention program. This program aims to reduce childhood lead poisoning through strengthening blood lead testing, reporting and surveillance, and linking exposed children to recommended services and targeted population-based interventions. Primary prevention involves the removal of lead hazards from the environments of children and pregnant people. Secondary prevention includes blood lead testing and related case management and referral services. The CDC receives results of blood lead testing from state health departments. This totals about 4 million per year. Lead screening is required for Medicaid eligible children at 12 and 24 months, or between 24 and 72 months if there is no record of testing. Lead screening is part of the early and periodic screening, diagnosis, and treatment program. There is also a risk assessment questionnaire, but it does not meet the Medicaid lead screening requirement. Only blood lead testing does. The majority of states have lower screening rates than the percentage of children at risk. Testing rates for most states have not yet returned to pre-COVID levels. Nationally, blood lead testing fell by 34% from 2019 to 2020. CDC recently updated the federal blood lead reference value to 3.5 micrograms, per deciliter of blood. Many states and local health departments are updating surveillance and case management practices to reflect this change. Due to this change, we expect to see higher rates of blood lead level cases as testing rebounds. In addition to the work that CDC does, there are other federal partners addressing lead hazards. The Department of Housing and Urban Development, the Environmental Protection Agency, the Occupational Safety and Health Administration, Food and Drug Administration, and the Consumer Product Safety Council. And there's others not listed on this slide. Additional agencies would also include the Department of the Interior and the Federal Aviation Administration. Housing is an exposure risk, or it can be a exposure risk. Lead-based paint and lead-contaminated dust are the two most hazardous and common sources of lead exposure in the United States. Lead-based paint can be found in housing built before 1978, which was also the year that it was banned for use in paint. It was used inside and outside of buildings and homes. Even if covered by newer paint layers, it can chip or deteriorate to fine lead dust and become hazardous. Deteriorating lead paint can mix with building dust or with soil that is tracked into the building or the home. It can also be found in soil around the outside sources of chipping paint. Remodeling buildings and work such as construction or auto repair and hobbies involving lead can contribute to lead dust in the building or home. Children can get lead poisoning by putting their hands or contaminated objects in their mouths, eating paint chips from peeling, or flaking lead-based paint and playing in lead-contaminated soil. Water can pose an exposure risk. Lead can be found in water when delivery systems contain lead and a chemical reaction occurs, causing the lead to leach into water. Sources of lead in water can be lead service lines, lead soldered joints, lead plumbing fixtures, and the components of well water systems such as faucets, valves, packers, or pumps. Land and soil can pose a risk also. Soil near roads can be contaminated by the past use of leaded gasoline. Lead is also found in areas of abandoned mines, in solid waste or tailings that remain after acidic materials are used to extract valuable minerals in mines. Tailings are sometimes used as fill material, applied as treatment on icy roads, and used as agricultural lime. Lead contamination can also be dispersed through groundwater and wind erosion. People can also get exposure to lead through the air. Lead is released into air by certain industrial facilities. Lead can also be spread through air if renovation and demolition sites are not following lead-safe practices for containment. Aviation fuel used for piston engines contains lead and creates airborne lead emissions. Although lead was outlawed for automobiles, for gas in automobiles, it's not been outlawed or done away with for aviation fuel. Other exposure risk can come from occupations or other sites. Industrial exposure to lead can occur for workers with jobs performing construction and demolition, ironworking, welding, smelting, manufacturing and disposing of some batteries, and pottery and stained glass production or repair. Workers can also bring lead dust home on work clothes and shoes. Shooting ranges where lead ammunition is used can also be a source of lead exposure. As you can see in this photograph, this is a comparison of a discharged lead bullet and a non-lead bullet. You could see the one that has all the small particles around it is a lead bullet. Lead is a primary metal used in the manufacturing of ammunition and fishing sinkers. Lead can spread into water and soil through these materials. Wildlife can also be poisoned through this exposure. People consuming wild game and fish can be exposed to lead through their food. This is due to the use of lead ammunition, lead fishing sinkers, and the bioaccumulation of lead from environmental exposure. There's also the chance of lead exposure risks from consumer goods and products. Potential sources of lead exposure through goods and products include cosmetics with a strong or a bright pigment, foods with ingredients grown or processed in lead-containing environments. Some foods, including baby foods, juices, and dark chocolate, have recently been reported to have lead in them. Certain imported spices and herbal remedies, antique toys, imported plastic jewelry and toys, and older vinyl mini blinds can also be sources of lead exposure. In this section, I'm going to talk about challenges and barriers in Indian country to lead poisoning prevention. Some of the topics I'll cover are social determinants of health, unique risk factors, healthcare funding and access, health disparities for children and pregnant people, the capacity for lead reduction, compliance with lead regulations, and unregulated sources of lead exposure. In talking about risk factors, we talked about social determinants of health earlier, what they were. So social determinants of lead poisoning for children under the age of 6 and pregnant people include being a member of a low-income family, having racial characteristics that are non-white, living in older housing with deferred maintenance, living in communities impacted by a history of housing discrimination, environmental racism, and disinvestment. The risk of lead poisoning is much less studied in rural communities compared to urban populations, but risk based on poverty and age of housing stock is prevalent in many communities. Unique risk factors for Indian country are: in 2021, American Indian and Alaska Native children under the age of 18 and the overall American Indian and Alaska Native population disproportionately experienced poverty when compared to some other racial and ethnic population groups. The 2021 census estimates show disproportionate poverty among those children and the overall American Indian and Alaska Native population. The estimated percentage of people living in poverty is highest among the American Indian and Alaska Native populations at 12.4%. Another unique risk factor is physical housing problems for Native American and Alaska Native households in tribal areas. These are more severe than the average US household in all categories, which are system deficiencies such as plumbing and heating, condition problems, which are structural, and overcrowding. As I explained before, there is a potential for multiple exposure pathways indoors, and there is a specialized risk for outdoor exposure from agricultural areas, roadways, mines, and hunting and fishing. Healthcare funding and access can also impact lead exposure prevention. The federal government fulfills its responsibility to provide healthcare to American Indians and Alaska Natives through the Indian Health Services, or IHS. IHS provides a comprehensive health service delivery system for approximately 2.6 million American Indians and Alaska Natives. IHS oversees the delivery of health services through direct services, tribally operated clinics, and urban health clinics. More than 2,000 facilities provide primary care and limited dental services to tribal citizens and their descendants. The uninsured rate for American Indians and Alaska Natives is the highest of any race or ethnicity in the United States. Medicaid expansion has not reached American Indians and Alaska Natives in states that have declined Medicaid expansion. American Indian and Alaska Native people often experience discrimination or racism and face systemic barriers to care, including higher rates of poverty and long distances to quality healthcare services. Maternal health disparities reflect ongoing and historical trauma due to colonization, genocide, forced migration, and cultural erasure, which contributes to health inequities. Due to ongoing and historical trauma, these populations are more likely to have underlying chronic health conditions and experience sexual or interpersonal violence. American Indian and Alaska Native pregnant people are 2 times more likely to die of pregnancy-related causes than white pregnant people. A significant portion of Native American and Alaska Native children are impacted by adverse childhood experiences. Many factors relate to these health disparities, including limited access to medical care for pregnant people and young children. Many tribal nations have limited capacity to track and apply for federal grants to fund housing repair and environmental services, and in some cases, such as in Alaska, may not have reliable internet to apply online for grants. Tribal communities, especially in rural areas, may not have enough trained workers available to perform lead hazard control services. Tribal nations have competing interests for housing programming, such as maintenance, new construction, and mobile home acquisition. Potential rehab participants can experience barriers to enrollment due to program requirements, such as clear title to the property and insurance policies. Low-income communities of color often have the lowest levels of awareness and compliance rates for federal, state, and local laws. Facilities in Indian country must comply with federal environmental laws and requirements in the same manner and to the same extent as any other regulated facility located outside of Indian country. EPA works closely with federally recognized Indian tribes to ensure compliance at federally regulated facilities in Indian country. Tribes authorized to implement federal enforcement programs must have enforcement authorities that are at least as stringent as federal law. Where tribal implementation authority is lacking or unavailable, EPA directly implements federal environmental programs and ensures compliance with federal environmental laws. In both cases, EPA works with officials in tribal environmental, health, and agricultural agencies on strategic planning, priority setting, and measurement of results. There are also additional federal laws and regulations that impact lead exposure in communities. The Clean Water Act, which prohibits anyone from discharging pollutants, including lead, through a point source into a water of the United States without a permit. The Department of Labor, Occupational Health and Safety Administration enforces lead standards for general industry to protect workers from lead exposure. And the Food and Drug Administration regulates lead exposure through food products available to consumers. If the FDA finds products that have excessive levels of lead, they work with the Consumer Product Safety Commission to issue recalls for the products. Unfortunately, there are also unregulated sources of lead exposure. One of the first ones of these is private wells. Similar to the U.S. population overall, tribal communities receive their drinking water through both regulated public water systems and unregulated water sources. The most common unregulated water source is private wells. Many of these are unidentified and they may not have been tested for safe drinking water parameters. Private wells are not subject to the EPA lead and copper rule for water. This rule states that public water systems must monitor for lead and copper at customer taps. This doesn't happen with private wells. Compared with children in houses served by a regulated water utility, children in homes served by private wells have a 25% increased risk of elevated blood lead levels. As we discussed before, ammunition and fishing lures are a potential source of lead exposure for tribal community residents, especially those living in rural areas practicing subsistence hunting and fishing. These sources of lead can contaminate wild game and fish being used as food sources. Again, as we've discussed before, aviation fuel is an unregulated source of exposure. Some people living near airports, which are often in close proximity to low-income communities of color, have experienced elevated blood lead levels and remain at risk for this type of exposure due to leaded aviation fuel. And finally, once more, consumer products are not heavily regulated. Some sources of this type of exposure can include imported plastic toys, jewelry, cosmetics, cake decorations, and spices. In this section, I'm going to talk about strategic planning considerations when working with tribal communities to reduce lead poisoning. I'll cover the CDC guidance, primary lead poisoning prevention, housing intervention services and capacity, repair and renovation messaging, community-based education and screening, data collection, evaluation, and strategic planning, messages on lead screening and poison prevention. I'll talk a small amount about a case study, which was done with tribal communities on wellness through traditional foods, which can have applications to lead prevention exposure. And I'll also start with a review of the federal guidance on lead poisoning prevention practices. Primary prevention involves the removal of lead hazards in the environment. Secondary prevention includes blood lead testing and related case management and referral services. CDC identifies lead-based paint and lead-contaminated dust as two of the most hazardous and common sources of lead exposure in the United States. The CDC recommends developing risk assessment and intervention practices that reflect community characteristics. Most lead hazard reduction and healthy housing programs are administered by local government entities and private business services through housing-related measures. These measures can include home inspection programs such as rental registration, property maintenance code compliance enforcement, or related. Programs for lead-based paint, hazard reduction, and abatement in housing are financed by grants and loans. Lead programs operate in compliance with the federal renovation, repair, and painting rule, and also in compliance with the Residential Lead-Based Paint Hazard Reduction Act, requiring lead-based paint disclosures for real estate transactions. Key partners in working with tribal communities on lead poisoning prevention are housing intervention services. Environmental health service providers should assess opportunities to build partnerships with tribal community housing agencies. They should also work with housing intervention services to create planning partnerships and to understand the community's capacity for lead hazard reduction programs. Lead case management practices should align to support interventions in communities. Some potential capacity issues tribal communities may face include financing plans for housing interventions that must accommodate high development costs. Rural tribes leading housing renovation and repair programs must often plan for small scale and decentralized work. Higher development costs are driven by limited infrastructure, smaller contractor pools compared to larger and more urbanized areas. Many tribal communities have limited technology infrastructure for shared case management. When we talk about housing repair and renovation, it's important to understand the need for worker messaging. The EPA Renovate Right program provides guidance for the renovation, repair, and painting rule. Any renovation, repair, or painting project in a pre-1978 home or building can easily create dangerous lead dust. EPA requires that these projects that disturb lead-based paint in homes, child care facilities, and preschools built before 1978 be performed by lead-safe certified contractors or workers. Federal law requires that individuals receive certain information before renovating more than 6 square feet of painted surfaces in a room for interior projects, or more than 20 square feet of painted surfaces for exterior projects or window replacement or demolition in housing, child care facilities, and schools. Again, these are buildings that were built before 1978. As part of the messaging, renovators or contractors must give homeowners and tenants the pamphlet that's pictured in the slide above before starting work. They must provide a copy of this pamphlet to child care facilities and general renovation information to families whose children attend those facilities. In general, anyone who is paid to perform work that disturbs paint in housing and child care occupied facilities must be certified. This includes all firms, including sole proprietorships. Another important part of lead prevention exposure programs is community-based education and screening. Community education campaigns are critical to improving understanding of lead poisoning risk, reducing exposure to lead hazards in the environments of children, and increasing surveillance rates. Education should support multi-generational engagement in the community, and education should include culturally relevant programming for the community. It's also important to engage and utilize community health worker services for prenatal and early childhood health. These health workers can prepare parents and caregivers for lead screening practices and to help them understand what needs to be done. And they can also help identify potential sources of exposure in the community. Another important part of Lead poisoning prevention is data collection, evaluation, and strategic planning. Key data metrics for lead prevention tracking and evaluation can include lead poisoning risks, lead poisoning surveillance needs and best practices, housing and environmental justice investment needs, health and housing intervention program evaluation. Strategic planning tools that can be helpful are community needs assessments, which can include key evaluation of community characteristics that inform sustainable funding planning, program management and implementation assistance, trainings on lead paint regulations, compliance, including contractor workforce training, funding of home-based resident education, and healthcare services for pregnant people and children under the age of 6. A health impact assessment, or HIA, can be used to evaluate objectively the potential health effects of a policy, program, or project on a population, particularly on vulnerable or disadvantaged groups before it is built or implemented. An HIA can provide recommendations to increase positive health outcomes and minimize adverse health outcomes. Parent and caregiver lead screening messaging is important. These are the types of questions that parents will ask and that you should be prepared to answer. When should children be screened? Between 12 and 24 months, or at 36 months if earlier screenings were missed. What is a blood lead level? Concentrations of lead found in blood identified in a blood lead test and reported in micrograms per deciliter of blood. Who gets these results? Parents and caregivers at the time of testing. Some healthcare providers, including public health service providers and federally qualified health centers, submit results to state childhood lead poisoning prevention programs for surveillance reports. If you have other questions or concerns about lead prevention in the community, tribal leaders can give you more information about any agreements in place with local and state health department offices to provide lead poisoning prevention and case management services. State case management plans explain what happens when healthcare providers complete testing and next steps if a child has an elevated blood lead level. Parent and caregiver poisoning prevention messaging should include the development and sharing of guidance on known environmental sources of lead and remediation resources for the community being engaged. In addition, you should also provide information on interim controls for homes and families, such as using wet cleaning methods, taking off work clothes and shoes before entering the home, and an emphasis on healthy eating. Now I'm going to discuss a case study. This one was actually about wellness through traditional foods, but it has applications in lead prevention. This is an example of working with tribal communities to promote policies, systems, and environmental changes that could be applied to working with communities to reduce lead poisoning. The CDC funded 17 tribes through cooperative agreements to implement a traditional foods program. The goal was to support traditional, sustainable, evaluable, ecological approaches to type 2 diabetes prevention. The program outputs included stories of traditional foods, recipe collections, and cultivation practices. The key takeaway idea from this case study is that outcomes included community-chosen and adapted policies, systems, and environmental changes to promote health and wellness. It's very important to include the community in any work that you're doing and in any programs that you're trying to implement. In this section, I'm going to cover lead program support resources. And this will cover engagement opportunities, grant programs for lead poisoning prevention, grant program resources for rural areas, education and engagement resources, upcoming lead screening and prevention resources, and emphasizing opportunities to reduce lead risk. Environmental public health professionals, or EPH, should research information on tribal community health and wellness programming. EPH can offer engagement through public health recognition and awareness campaigns, such as the National Healthy Homes Month and the National Lead Poisoning Prevention Week. EPH should request comments and inputs from tribes when developing lead poisoning prevention plans. And EPH should collaborate with tribal communities to assess federal funding opportunities for lead poisoning prevention. This is just a slide that shows grant programs for lead poisoning prevention. You can search for them very easily on www.grants.gov, and the different federal grants should be available on that website. And many of them are offered for tribal communities to reduce the potential for lead poisoning. A new program is being led by the USDA Rural Development Group, the Rural Partners Network. It is an alliance of federal agencies and commissions working directly with rural communities to expand rural prosperity through job creation, infrastructure development, and community improvement. The Rural Partners Network will help rural and tribal leaders to find dedicated tribal programs and resources, navigate and access programs from across the federal government and other providers, secure technical assistance, and develop local capacity. And you can find that program at www.rural.gov. Other government entities provide education and engagement resources that you can use in communities. HUD has them, EPA has them, and CDC has them too. The National Environmental Health Association has recently developed 3 screening and prevention resources for environmental public health professionals to share with the tribal communities they serve. These should be available to EPH soon, but we have the lead poisoning prevention in tribal country fact sheet, access to lead screening and hazard control, and lead poisoning risk in tribal country, which is an infographic. All these things should help you to explain to your communities how lead poisoning prevention works and what steps should be taken to lower the risk. Always take opportunities to reduce lead risk. The key takeaways from today's presentation are: always work with tribal communities when developing lead poisoning prevention plans. Develop and share guidance on known environmental sources of lead and remediation resources with the communities being engaged. Follow the CDC lead poisoning prevention recommendations for primary and secondary prevention. Provide information on interim lead poisoning prevention controls for homes and families that include using wet cleaning methods, taking off work clothes and shoes prior to entering the home, and healthy eating. This is our acknowledgement, and we want to thank CDC and the Agency for Toxic Substances and Disease Registry for funding this training. And now we can go ahead and take questions, or I can go ahead and take questions.
Thank you, Susan. We have a few questions for you.
Okay.
The first question that came in is, does the no safe level policy apply for just those under 18, or is it for everyone?
It's for everyone. Really, we want to minimize the amount of lead that people are being exposed to in their homes and in their communities, because they can actually bring it into the home or into a building if they're being exposed. Plus, it's also not healthy for them.
Another question we have is, do HUD, EPA, CDC, and the other agencies and organizations you talked about that are working on lead, are they all working together, or is that separated with the different agencies working on specific topics within lead prevention?
I do know that some of them, on some projects, they will work together because they're dealing with issues around housing and contaminated soils and different types of things. So they will work together on that. In other cases, depending on what the lead problem is, they will work separately because they'll have separate regulations, let's say around mining sites or different types of contamination. So it really depends on what the issue is. I would always advise people that if they're working in communities with these problems, is to check with these agencies and see what kind of resources or information they can bring to bear on the problem. And because there's no one size fits all, is what I will say.
True. This question just came in as well.
Mm-hmm.
And it states, food available on reservations is often low quality, lacking in fresh options like produce, and more expensive than in other communities. Given this systematic barrier to healthy eating, how can we support Native communities to access higher quality, fresher food to support prevention of lead poisoning and other diseases?
Well, I do know through the diabetes prevention program that they were encouraging people to, in cultivating fresh foods and vegetables and food sources such as that, to help not only prevent diabetes, but that can also help people in having healthier response to lead exposure. So I would encourage people to work with Indian community agricultural agencies on those types of programs, and also with the USDA and those types of entities to talk about what can be done to increase the quality of the food available to tribal communities.
Are you aware of this? I'm just asking.
Sure.
Are you aware of any programs that are the greening of tribal communities, community gardens, any effort to move that along in the spirit of lead prevention?
I don't know of any in particular, but that doesn't mean there aren't any. I would say that one of the first places you could start is also, as I said, with USDA and CDC about those types of initiatives, because it may very well be going on. And of course, I don't know of every program out there. So, but I am saying that the case study we did talk about, I know that they were emphasizing the cultivation of healthy foods for the communities, and that could be applicable in this case also.
That's what I was wondering, because it seems like it's such a great initiative. It's going on in neighborhoods and cities, across the country, that just for myself, a questioning was, I wonder if this is going on there as well. So other questions that we have is, when lead enters the child's bloodstream, what exactly happens?
When that happens, the lead actually can interfere with the development of the child. I can't tell you exactly biologically what happens, but it actually interferes with the nervous system and with brain function, things like that. In a pregnant person, what happens is lead that they were exposed to as they were growing or are being exposed to in their environment, actually during pregnancy can get released to the fetus, and that's what causes problems with fetal growth and other problems with that. So it does have impacts neurologically and physically.
Another question we have, you mentioned this some in your presentation, but if you could go back to it a little more, is how do social detriments of health impact lead exposure?
Social determinants of health impact lead exposure because you have people who don't have access to good medical care, so they're not being screened for lead poisoning. They're not being treated for lead poisoning. They're living in housing that's deteriorating and exposing them to lead dust. They're working in occupations where they're being exposed to lead dust. And the proper precautions and things are not necessarily being taken to protect them from that. And it's also the housing, it's very hard to come up with the money to repair housing. And as I said, a lot of times people who are interested in having their homes repaired, or communities are interested in having a number of homes repaired, have issues because there's no clear title to the property, or there's no homeowner's insurance, or different types of, I would call things that are normal for most of us are not normal for a lot of these communities, such as having housing insurance or clear title, because homes get passed on from generation to generation. So they don't actually go through formal title transfers and things like that. You know, also part of it is people just don't have this information. They don't know. As I said, you know, normally we would rely on our healthcare providers to give us a lot of information and talk about these things. But if it's, you know, 100, 150, 200 miles to get to a healthcare provider, you're not going to go very often. And you're certainly not going to know to ask these questions. So those are all part of social determinants of health.
Thank you for that expanded explanation. We have another question.
Okay.
And it reads, do Indian communities report their child lead poisoning test results to state, which then report those numbers, or do they report the number themselves? And do the tribes follow state law for reporting, or do they have their own requirements for reporting?
That depends on what state they're in and what agreements they have with their state and local health departments. Again, it's going to be, you know, all over the place. And that's why it's important to check with the different entities in your state, you know, your state health department, your local health department, the local community you're working with, to ask about these things, because it's going to be different everywhere.
And we look like we have time for this last question.
Okay.
And it is, can you recommend where families can go to find lead inspections on Indian communities?
They should talk with the entities that I had listed earlier. They could talk with the housing agencies. They could talk with tribal government. Many tribal governments have their own environmental health specialists. They can talk with them. They can reach out to their local public health department and talk with them and get guidance on where they can go. There's a lot of different resources out there. Now, I'm not saying it's going to be easy, It's a lot like finding people to do radon mitigation in rural areas. Sometimes you have to be persistent. And I would recommend, that's why we recommend the interim controls. In the meantime, if people are having trouble finding ways to have the lead in their homes remediated, is that they take the interim steps to try to minimize the amount of lead dust that they're being exposed to and that their families are being exposed to.
Again, thank you for all your information. That is all the time we have for today. We at NEHA would like to thank Susan for sharing her expertise and her time with us. And as an attendee, your feedback is important to us, and we encourage you to fill out the survey you will receive. This will help us to continue our mission to build, sustain, and empower an effective environmental health workforce. If you're not a NEHA member, we encourage you to become one. And you can find that information on our website at neha.org. Again, Susan, thank you so much for sharing your expertise. And to those of you attending today, we thank you for your time as well. Have a wonderful rest of your day.
Thank you.